Hello, this is Joe Moore, and I thought I would give you some instructions on how to properly complete a CMS claim form. First thing you want to remember is that everything has to be in caps, and also you cannot use any abbreviations when you complete a claim form. So we'll start with block 1, and you'll notice that you need to place an X in one of these blocks to indicate the type of insurance that you have. So if you have Medicare, or Medicaid, or TRICARE, or CHAMPA, or group plan, or FICA, or other, you would mark an X in the appropriate block. In 1A, you're going to demarcate the patient's ID number for their insurance. This number has to have no dashes and no spaces. So even if the card presents that way, you are to type it in with no spaces and no dashes. They have a group health number. You put the group health number over here farther on the line, so you'd space down and place it over here to the far right of the line. You're then going to come over here to block 2, and you're going to complete the patient's name. So you're going to type in the patient's last name, comma, space, first name, comma, space, and then the middle initial. If they have a junior attached to their name, you would type in Smith, space, junior, comma, space, John, comma, space, A, for instance. If they're a doctor or have a title with their name, we do not include that on the claim form. Underneath that, then, in the next block, you're going to enter in the patient's mailing address. Again, we do not use abbreviations, so if it's avenue, road, street, any of that, you're going to type that out completely. Put in their city and their two-digit state alphabet. Put in the zip code. This is one of the only places you can put in a dash. So if they have the elongated 4-digit zip code, you'll just add in the first 5 digits, comma, and then the next 4 digits. For their phone number, you can see there's already a parentheses to put in the area code. And then when you type in their phone number, you type it as one long 7-digit number. You do not put in a dash or a space. Let's go up here to block 3. Up here, you're going to put in the patient's date of birth, and you can see that you need to have month, day, day. And they write century, year, year. So you need 8 digits. You also need to put an X in either the male or the female box. Underneath it in block 6, you're going to type in the relationship of the patient to the insured. So if it's self, or their spouse, or their child, or other. Other indicates either a domestic partnership, or you could also insure your parents, so you would stick in the other in that box. And then you have the patient status, whether they're single, or married, or other. Again, the other is if they're a domestic partnership, you'll want to put that in there. And underneath that, we have whether they are employed, a full-time student, or a part-time student. So a lot of insurance companies will insure your child till they're 25 if they are full-time students. And now filling out block 10 down the middle, this is very important. Insurance companies need to know if another insurance company might be involved in this claim, and if so, they would want to have it marked here. So if it was a workers' comp claim, you're going to put in yes for employment. If not, no. If it's an auto accident, yes. If not, no. And if it is, then you'll type in the date. You will type in the state where the accident occurred. And then if it's another accident, like a slip and fall at a store, something of that nature. And if it's not, then you would type in no. If any of these have yes marked in them, they're going to have you send you a letter and ask the patient if they have another insurance company involved. And if they do not, they'll pay the claim. Let's then go back up to block 4, talk about the insured's name. So if the insured and the patient are the same, you'll just type in the word same. But if they're not, you'll type in the insured's name. So again, last name, comma, space, first name, comma, space, and their middle initial. And under block 7 is the address. So you could either type in same if it's the same, or if it's a different address, you'll type that in. This would come in very handy if you're typing in for the patient as a child who is away at college, and so you'll have their college address, but you would have the insured's home address. Underneath that, then, if you have a insured's policy group number, you can stick that number in here. Underneath that is the insured's date of birth. So if the insured is not the same as the patient, you would have to have that date in there, and the sex of the insured also. And then you have the employer's name. So this insurance came through their employer. They have a group plan. you'll type in the employer. If the patient is retired, you'll type in the word retired. That relates to Medicare. Underneath that, then you have the company's ID number for the primary insurance. And this is indicating whether the patient has two carriers. So if they only have one insurance company or they have Medicare, you would leave this blank. But if they have other insurance, you type in yes. If they do not have other insurance, you type in no. And you can see here it says if they do have other insurance, you're going to go over here to block 9, and you're going to fill in this other information. The other insured's name, the other insured's employer or policy number, the other insured's date of birth and sex, and the employer name, and here the policy number for the other company. We'll drop down to block 13 or block 12. Block 12 authorizes payment of medical benefits. This is signed electronically, so you're just going to type in signature on file, or you can just type in SOF. Here on the date, you're going to have an 8-digit date, no dashes, no spaces, no slashes, just one long 8-digit number. Again, on this section, you're going to write either signature on file or SOF. This authorizes the insurance company to pay the doctor directly for services supplied. We'll drop down here to the block 14 that talks about the date of the current illness, injury, or pregnancy. So what we're kind of looking for here, though, is for pre-existing conditions. But you'll type in here when the patient states they had this illness occurred. If the patient never has had same or similar illnesses, you'll type in that date here. So if someone has diabetes, for instance, you'll type in all that number for them. This is to indicate if the patient's unable to work. So if they're going to be disabled, you'll type in last date of work to the first day before they return to work. Block 17 is the name of the referring physician. So if there's a referring physician, you're going to type in his or her name, and you'll just type it first name first. So it'd be John Smith, MD, no dashes, no periods, no commas, just the name just written standard-wise. And then you're going to type in that referring physician's NPI number so we can indicate who the doctor really is. And here you're going to indicate, in this block you indicate if a patient has been hospitalized. So the date they were admitted to the date they leave. In this block here, reserved for local use, we use this very seldom, but we can, if we're attaching forms, we could put we would write that in attachments, special report attachments, or we would type in here for anesthesiology, the type of anesthetic agent they used, or if we're giving durable medical equipment, we would type in the numbers of that equipment. Otherwise, we leave it blank for regular services. This is an important one. We don't do outside lab anymore. Insurance now in California, you can't refer to yourself, so we don't do labs anymore. So outside lab, we would almost always indicate a no. So you need to make sure to put an X in that block. Drop down then to block 21. And this gives us information on our diagnostic codes. So we're going to type in our ICD-9 code here. When we talk about ICD-9 codes, for instance, diabetes would be a 250.00. We don't type in the dot because the dot's already on the form. So you would type 250 and then come over here and type in the 00. So there's 4 spaces for diagnoses. Over here is if we've submitted a claim to Medicare and it's come back that we need more information, we would have a resubmission number to resubmit this paperwork to them. Down here in 23, this is an authorization number. So if we're having a procedure done that needed prior authorization from the insurance company, they would provide us with a number okaying the procedure, and we would type that in. Now we're going to drop down to the service section. So these are all the different services that can be performed. There's 6 spaces for them. So we have a from and a to. We only use the to if we're combining services. So if we have like services performed on consecutive days, we could type in a from and a to. So if we did 3 office visits, same type of office visit on consecutive days, we could type those in and combine everything as one. But usually we just type in one service, and when we do that, we only need the from date. We leave the to date blank. Place of service code, these are indicated in your CPT book, and place of service would be, for instance, a doctor's office would be an 11, a hospital inpatient would be 21, hospital outpatient would be 22. This block here where it says EMG, This is if your insurance has a special emergency rider. So sometimes companies, if you have an emergency procedure, they don't have to pay the deductible. So we would put an X in that block. Next to that is CPT codes or HCPC codes. These indicate the type of service. And then there may be modifiers attached to those. You would put those here. This is the diagnostic pointer. So what they're asking you to do is to go back up to block 21, and you can see you have 1, 2, 3, 4 pointers. So instead of writing the diagnosis again, you just bring that number down to here, and you would type in 1, 2, 3, or 4, and you would just match up the service with the diagnosis. In this section, then we put in the services. We have to always put in the pennies amount, and there's never a decimal point, so put in the dollars and put in the cents right here. Next, our days are units. We have to always have a number in there, so usually it's an office visit. It was 1 day, 1 unit. We had a surgery 1 day, 1 unit. We then have the NPI. So we're going to put in here the NPI number of the physician who performed the service. Most of our doctors work at a clinic, and the doctors we'll be doing in this class come from a clinic. So we have to identify who actually did the work. So we put in that doctor's NPI. So we continue to fill out these blocks with however many services were performed. We then would go down and add up those services. Again, we need dollars and cents. In this block, we only add money in here if it was paid by another insurance company. We do not put money in here paid by a patient. In this, we would put in the balance due. We're going to come back over here. We're going to fill in the provider ID number, the federal ID number. This is for the company. So like I said, a lot of times you work for a clinic, and you have different doctors working for the clinic. If you put in the doctor's federal tax ID number, then that physician's going to be paying taxes on money he didn't receive. So you want to make sure you put in the ID number for the clinic into this space. There'll usually be an EIN number unless the physician has no employees. So we type in X for the EIN. This is a patient account number. It's not read by the insurance company, so you can place any number that you want in there that works for your internal accounting for your office. Here, accept assignments. This is usually only for government, but recently they've been having everyone that accepts assignments. So Blue Cross, private carriers, if the doctor takes assignment in full. We'll drop down in here to the signature. Because this is an electronic claim, nobody signs this, so we type in the doctor's name, and we just type it first name first, any middle initial, then the last name, and then MD. No periods, no commas. We then have to put in the date, and the date has to have 8 digits, no slashes, no dashes, just one long number. The patient is seen outside of the doctor's office, seen at the a hospital, or seen at a nursing facility. You're going to type in that name, that address, and then you have to add their NPI to identify them. Coming over here, this is the billing service. So usually it's going to be a clinic name, but it might be the doctor name. Put in their full address, put in their full phone number. Again, no dashes or spaces. Make sure their address has full names, no abbreviations. Make sure the zip code is completely filled in, and you could have a dash if it's the elongated zip code. And then you must have the doctor's NPI. Otherwise, we can't send them a check. I hope that's helpful. I think that gets us through all the blocks that we need, that we have trouble with. This is a standard format, and different carriers, Medicare, Medi-Cal, those different carriers do have some differences that they use when filling out the form. But this would be your template for an average insurance payment schedule for a CMS claim form. So I certainly hope this helps you, and I hope you have a great learning experience. Thank you so very much.